Hormone Replacement Therapy, HRT. This is a topic many people have questions about, so let's dive in. Menopause is defined by the ovaries stopping their function, leading to the end of menstrual periods and the production of essential hormones. This transition typically occurs between the ages of 45 and 55. Symptoms can include hot flashes, night sweats, mood changes, sleep disturbances, weight gain, and decreased libido. Testing for menopause isn't always necessary. It's a clinical diagnosis based on symptoms and the absence of menstrual periods for 6 months to a year. Tests like thyroid function and prolactin levels might be needed to rule out other conditions if there's uncertainty. HRT is often started to relieve severe menopausal symptoms like hot flashes, night sweats, and mood swings. The best time to start HRT is within the first 5 to 10 years after menopause begins. Estrogen and progesterone are the common hormones used. If you've had a hysterectomy, only estrogen is needed. Estrogen can be given as tablets, patches, gels, or creams. Progesterone is usually given orally. Modern HRT regimens are considered safe, especially when started early in menopause. Modern studies show that the risk of breast cancer is minimal when HRT is started early. The benefits of HRT include improved quality of life, better sleep, and reduced risk of osteoporosis and fractures. Vaginal dryness and painful intercourse are common menopausal symptoms. Local estrogen therapy in the form of creams, tablets, or rings can effectively treat these symptoms and is safe for long-term use. HRT is not recommended for women with a history of cardiovascular events like strokes or heart attacks. The risk of blood clots and strokes can be minimized by using transdermal methods like patches or gels. If you're experiencing menopausal symptoms, talk to your doctor about HRT. There are safe and effective treatments available. Remember, you're in charge of your health. Thank you for watching. If you found this video helpful, please like, subscribe, and leave a comment sharing your experience with menopause and HRT.